Good morning and welcome to the Doctors In Ask Dr. Arwady. Thank you for being with us. I'm Sybil Madison, your Deputy Mayor for Education and Human Services. And here is Dr. Allison Arwady.
Good morning, everybody.
Our Commissioner for Chicago Department of Public Health. We are happy that you're here with us to hear the latest updates and to get your questions answered. You can submit questions in the box below. You can also send them to us through Facebook or Twitter using the hashtag AskDrArwady. We always check our social distance before we start, and we're in good measure here. We want to remind all of you who are still working, our essential workers, to practice that social distancing when you're in your workspace, and this is just a really easy way to check and to keep track of that. Here at the City of Chicago, we have safety officers assigned to kind of monitor how we're doing with our social distancing and other measures that we need to keep in mind for those of us who are working. So think about that too. How can you have a safety officer in your workplace or even in your home who's making sure that you're washing your hands frequently and checking your own symptoms and isolating yourself if you're sick. So.
Yeah, and safety officer, it's not somebody with medical training, it's not somebody with any special expertise, it's really someone whose job it is to help people maintain that social distance, to make sure that cleaning is happening appropriately, and as always, if there's anybody with symptoms, you just can't be out. So people probably have seen increasingly, we're seeing places where folks are checking temperatures or asking questions if people are coming into buildings. All of that is just about identifying people with symptoms and them not working. So as always from the beginning, we've been saying anybody who's sick, even just a little bit sick, you must stay home. I don't care how essential you are. You will not, I've been saying this from the beginning, you will not see me out if I'm feeling even a little bit sick while I look to see what's happening.
And that is an order.
It is an order. It is an order in Chicago by law. It was I believe, our very first order. Yes, under the first commissioner's order. We did that back way even before the Illinois stay-at-home order went in place, because it's out of all of it, it's probably the most important. There's a lot of important things, but that one is really critical. Actually, I'm glad you brought up the social distancing thing, because the other piece that I wanted to just mention before we get into the data is that obviously, more and more people are wearing these face coverings, right? And this is something we've been talking about, and I'm guessing we'll have some more questions and we'll talk some more about it today. But it is so important that even if people are wearing those face coverings, those are not really about protecting you, right? We've talked about this. This is, to an extent, helping keep your potential germs from coming out. And again, it's because we know that there are some people who can spread coronavirus when they have just very mild symptoms or even no symptoms. But this does not keep all of your germs from coming out for sure. There's actually been some studies that, even with that surgical mask, even with, the kinds of cloth masks that people may be wearing, it is not an airtight keep everything out. It probably helps keep things from going further distances. It has a piece to it, but it is not also about, it's not a seal around your mouth. And so my concern is that I'm out and about a fair bit. And so, like yesterday, I was at a hospital, which in a hospital, certainly they have a universal masking policy that is appropriate when people are out and moving about. Or this morning, I was at a meeting and a lot of people are wearing masks. Fine. But you have got to keep the social distancing stuff in place. And my concern is that sometimes people will think, oh, I have this mask on, like I'm good. And then especially where we see people with masks, it can be harder sometimes to, if you're talking to somebody and you both have masks on, you can't see somebody's mouth. It can be harder to understand what they're saying, and people can sort of get a little close to each other, like as they're talking. And the other thing is that we really, really have got to keep hand washing and trying to not be touching faces. And so the masks are a little bit in that setting, or the face coverings, right, are if they're making you touch your face a lot more, and you're moving them, and you're messing with them, and they're uncomfortable.
Oh, that's such a great point.
There can be some use, but they are like down here in terms of the list of the most important things. The staying home as much as possible is right up there. Like, that's number one of all things. Like, you are safest when you're at home, especially if you're in that vulnerable group, over 60. Underlying conditions, we really just want you home as much as you can be. For the people who need to go out,
Yes.
for doing these essential tasks or the essential workers, keeping that social distancing, like really maintaining that is so important. The hand hygiene just cannot be overstated. The studies that have been done with masks, they show that they, where there is some potential benefit to them, it's like secondary to the hand hygiene, or it's in conjunction with the hand hygiene. And so just remembering that even as we are wearing some more of these, they're really designed, and if you read what the CDC guidance says, they're designed especially for settings where you may not be able to maintain that social distancing. And so, like right here, when we're sitting and we're maintaining our social distancing, I'm not necessarily, I'm not wearing that mask. If I'm out in a setting where I may be interfacing with more people, or you're moving around, that's more of the setting. And if you really look again at what the guidance says, it talks about going to a grocery store or going to a pharmacy, being in these settings where it's a little less predictable and people aren't always able to keep that distance. And again, you're really keeping your germs from getting to others, at least partially. You're not keeping the germs from getting on you. So I thank you for bringing it up right from the beginning, because it remains I think a piece people have a lot of conversation about, and I just want to make sure people have the good information about it.
So there's some priorities in terms of our preventive measures, and we shouldn't think that because we have more people wearing masks
or face coverings
or face coverings that there's some super duper level of protection. The priorities in terms of prevention remain the same.
Yeah, exactly. And it's about settings where you may not be able to maintain that social distancing is really the most important piece of it. And there's even, I know there's, because I follow the online conversations, there's some thought about, are there, in Asian countries, they tend to wear masks more. Is that part of it? Like, these are big questions. These are some of the things that are under study. But I'll tell you that, people wear a lot of masks in Japan, but actually Japan has been seeing a surge in its cases again. Singapore really stuck to masks in healthcare settings and had reasonable control. China early had masks, has had changes. Like, this is not a black and white question, to kind of be clear about it. And I do think that, as I've said, they do play some role for especially people who are asymptomatic, who, you want to be doing what you can. If, God forbid I had coronavirus right now, if I were out in a setting where I was going to be within 6 feet, having some covering would potentially help protect some of those germs. But way more important is me not going out at all if I have any symptoms, maintaining that social distance carefully, doing all of the hand hygiene, not touching my eyes, my nose, my mouth, which means not messing with a mask that's on there a lot too. Yeah. And then if I were in that vulnerable category, just not doing any of that, right? Really, really staying home. So. Yeah.
And I'll just add, we had some days of warm weather.
Yes.
I saw more people out as I was driving around. I encountered traffic for the first time in several weeks. And so I think it's also important to say that just because you have a face covering on doesn't mean that you can now join your friends or have a play date or get together because 100%. You all have on
100%. Yeah, yesterday, if folks saw at the press conference yesterday that the mayor did and that I was at, they talked about, we really had seen in the setting of that first really warm night, the police had to do hundreds of dispersal orders. I know people want to be out. You can be out by yourself. It's safe to be out by yourself. There are not clouds of coronavirus sort of in the air outside your home. You can be out. It's good to get a little bit of fresh air, to get a little bit of sunshine, but you cannot congregate. And if you have that face covering on, that does not change that guidance really in any way.
Right.
So. Yeah. All right. Thanks. Okay. So let's talk about numbers. As always, chicago.gov/coronavirus is where you find all of our latest data. Up at the top, there's a latest data tab. And we're really putting new things up there every day. So not only do we update this data every day, we're updating our maps 3 times a week, our testing data once a week. Down at the bottom, you'll see we've started linking to articles that have been published by the Chicago Department of Public Health about coronavirus. So there was one early on about the first case of human-to-human transmission that had been seen in the U.S., right? That was back in January, the woman to her spouse, and that was a big investigation with the state and the hospital and some folks from CDPH, but that is a local story that's been published. And then also today we did put up the article that folks from the Chicago Department of Public Health had done describing an early family cluster here, where in 2 extended families, before the stay-at-home order was in place, CDPH did its standard, this is bread and butter public health, the same thing that we do for when we're investigating any kind of outbreak, whether it's infectious disease, whether it's COVID, whether it's measles, whether it's a foodborne outbreak, whether it's a sexually transmitted infection, whatever it is. This work of actually, when we get a case that's reported to us by law, I've got teams of investigators, epidemiologists who are in touch to say, what were your symptoms? When was your onset? Who were you in touch with? Can we figure out what this spread has looked like? What can we do to reach out to others who may have been at some risk? And so we describe a cluster in 2 extended families that really were linked to things that families normally will do: a funeral, a child's birthday party, some church and sitting closely together. And you can really get a sense, if you read it, of how important then the social distancing and these stay-at-home orders. It's all this is about is just a specific example that helps people understand how it can spread. We see clusters like this all over the city. There's nothing special about this one. But you'll also see that we identify both people who were tested and were confirmed and people that we consider probable cases, which means they had a contact, they had some symptoms, they may not have ever gotten tested. And it gives you a sense of some of how, we keep track of that. We know not everybody is getting tested.
Yes.
Anyway, so if you're interested, take a look, and if you have questions, put it in. It was published in the CDC's weekly. They have something called the Morbidity and Mortality Weekly Report. It's like the CDC's journal. And so it's very common when you're doing public health investigations that are helpful as beyond Chicago, right?
Yes.
Where you think about other parts of the country, especially ones that may be a little bit earlier in our outbreak, and wanting to make sure that you're putting those social distancing in place, some of that kind of stuff. That's part of why that's done.
And you've talked about how there's research happening all over the world.
There is.
We're trying to understand this new coronavirus.
Exactly.
And so this is our contribution.
It's our contribution, and it's really, you see me up here, but I've got a whole team of people. I've got, just at the Chicago Department of Public Health, I have, adult infectious disease doctors, pediatric infectious disease doctors, people who are specialists in environmental health. I have a veterinarian. I have a physician who's got specialty in behavioral health, and maternal, infant, child, adolescent health. I mean, lots of folks, and those are just the doctors. I've got epidemiologist teams, I've got other scientists, I've got our big nursing corps, I've got our lab specialists, and all of us are working really hard, not just on the outbreak, but on staying up to date with what's coming out. Every day there's new research that comes out. We also are in touch with our colleagues across the country, with the CDC. So know that as we're talking about this and talking about this guidance, as things may change, it's because it's as new things evolve. This virus, again, what is it, April, right? This is four months old. There are still a lot of questions about things like influenza, right? Things that come around every year, lots of questions that have been studied for years that are still kind of under consideration. This one is literally a few months old, and so every day new data comes, and we do try to bring it to you, particularly when questions come up, but that's just part of the nature of this as we learn more about it. So, all right, so let's do numbers quickly. So in Chicago, we're at 6,099 lab-confirmed cases of COVID-19, and we're up to 177 deaths among Chicago residents. In Illinois, we're at 15,078 cases and 462 deaths. We're at about 400,000 cases and nearly 18,000 deaths in the U.S., and about 1.4 million cases and around 80,000 deaths worldwide. So, just really continuing to grow. We've talked a little bit about, I think it can, when people are hearing, or if you're keeping track of our Chicago data, yesterday, for an example, we had an increase of 588 cases reported, and that is a lot of cases. But if you think about, where we're at about 6,000 cases overall, we've been talking about that doubling rate, right? Yes. And initially, where we were seeing the cases double every day or two, you move from 5 to 10 in a day, or 10 to 20 in 2 days. Those numbers don't sound so concerning to people, but that rate of doubling is what makes us the most worried as epidemiologists, and it's why we work to quickly get those orders in place. We've moved from that sort of doubling every 1 to 2 days, which if we had continued on that path, we would long since have overwhelmed our healthcare system, just to be honest about it. And we'd be seeing, as opposed to that flattening the curve, that would have kept us on that very steep uphill climb, and already we would be out of beds and out of capacity. So we saw, as some of the orders were coming in, that flattening first to a doubling about every 4 days, and then we've seen some more flattening where we're down to a doubling of every 8 to 10 days. Across the state, they're at about a 7 to 8. Here, we're maybe an 8 to 10. I want to show you some data related to this, probably. We've been having some ongoing work, and I think the thought is potentially next week to sort of show this in some more detail, where we've really seen the full effect of the stay-at-home order. But we're seeing some flattening. We need to get to the point where not only are we doubling every 10 days, but we get to a point where we're not doubling at all and then coming back down. But 588 cases is less than 10% of 6,000 cases. And so if you think about that, 588 cases, it's a lot, but it is kind of in line with that lower, that lower rate of increase. And that's why this can be hard for people to understand. You're saying, you're adding like hundreds and hundreds of cases, and that's bad. And of course it's bad, because those are more cases. And I mean, that's 600 new people who have been diagnosed, and all of for the people who have serious illness. I mean, that's bad. But in terms of sort of our curve overall, we are seeing flattening, and you are doing that by staying at home. That flattening has nothing to do with us building McCormick Place. It has nothing to do with us, all the work happening at the hospitals for getting more ICU and getting more vents. That is about us having fewer new infections. And the biggest thing that all of us can do is limit interactions, especially right now in the month of April, with people outside of our households.
Yes.
So I think we'll just look at a couple of graphs. A couple of figures quickly. We talked a couple days ago in a lot of detail about how we're now showing maps about cases and case rates. There are new maps you can see even from Monday that are up if you're interested there. But let's look quickly at some of the testing, both cases. So the first one is up, and you'll see that this is really looking at the number of individuals who had been tested by Chicago zip code. And if those of you who have been watching along will see that, again, the darker blue areas where we've had more individuals tested, and we divided into these quintiles, meaning into 5 groups. And statistically, where you're in a very light blue versus as it gets darker, that means there's something statistically different between those groups. So you can see that in the same way that we saw the cluster of individuals down on that southeast side, and we saw that cluster up north, some on the west, that part of that is because there's been more testing in those sites. Because again, as we see cases, we're going out and working to really identify others who may have been at risk, really pushing, and where we talk about our really striking race and ethnicity disparities. I want you to know also that more testing has also been done in African Americans than other groups, and so these interplay with each other. Let's look at the next map, because this is the rate of individuals. And for those of you who weren't with us a couple days ago, that first one that we look at is just numbers of people tested. It's easy for people to understand. This one is where we actually correct the number of individuals tested for the population. And so this is kind of a better way of really understanding. If you have a zip code that has a very lot of people in it, you would expect there to be more cases. You would expect there to be more tests. And so a rate really lets you see, as you correct per 100,000 population, where are we seeing a lot of testing. And so if you look there, we really are seeing on the southeast, but a little further north than where the other one was. We're seeing some additional testing in the middle there across the west side, which is good because that's important, and some up in the far north in these sections. And so at CDPH we look at these, and as we're certainly working, and every day we're working to get additional testing capacity, working with the state, working with the federal government. We really want more testing capacity here, but we use both where our cases are as well as where the testing rates have been to really work on building some of that up. So just wanted to give you a quick look at some of that.
So important for people to know that these data are actually acted on.
Yes.
They're not just presented.
Exactly. Yeah. All the work that my EPIs are doing every day is really designed to help us answer questions about Chicago, and about, are there things that we're seeing in Chicago that are the same or different as other places? Where and how should we be concentrating resources?
Yes.
We obviously put a lot of priority on any of our congregate settings, meaning places where people live all together. So that's our homeless shelters, where we've done a ton of work, continue to do a lot of work. Our long-term care facilities, Cook County Jail, right? These are really high-risk settings, and we are very aggressive there in terms of doing what we can to work with those facilities to limit cases, to space folks out, to do testing, but those are complicated. But then, beyond that, at a community level, where are we putting those resources? Where are we recognizing vulnerable folks are in different ways and what we can do.
So and we're using these data in our racial equity rapid response team work as well.
Absolutely. All right.
Oh, questions. All right. Lisa Beamer from Facebook. High-rise dwellers in Chicago elevators, what should we be doing?
Okay. So we've been getting a lot of questions, actually. I also keep track, we have an email address and some other things, and I hear that we've been getting a lot of questions about high-rises and about apartments. So first, I want people to know, if you go on the website, we have something called Guidance for Multifamily Residential Buildings. And if you go in there, it really goes through in quite a lot of detail, what are the specific safety measures building owners and managers should be taking? What does social distancing look like? Where do we recommend cleaning? What is the recommended procedure if a resident is sick or tests positive? What about an employee? What if repairs are needed in a unit? Are there different procedures? More information for landlords and renters. So I encourage you to take a look at that for some detail. But I think the question was about elevators
in particular.
Okay.
The buttons. You're pushing buttons.
Absolutely.
Other people are pushing those buttons.
Absolutely. So, and that's a good question because, again, we're not concerned about people being in an apartment in your own apartment in a multi-unit building. We don't have concern for sort of being in a large building that has people who may have COVID and are recovering at home. But where you think about those common spaces, and especially where people may be touching them, things like elevator buttons, things like door handles, the mailbox, all of these kinds of things, those are exactly the sort of spaces where you want to make sure there's cleaning, certainly, but also on an individual level. Think a lot, like if you've just come in, right? If you've touched those elevator buttons, please wash your hands, right?
Yes.
Like before you touch your eyes, nose, mouth. Again, reminder, germs don't jump off an elevator button like into your eyes, nose, mouth. They have to get there through touching them. And this is that fomite transmission. That was the fancy word we used the other day.
Yeah.
And so, I actually do this every day at work. Like we are still working at Chicago Department of Public Health, obviously. We have social distancing in place. We have had, as a large employer, we've had a couple of cases among our own employees, and many employers are dealing with these same situations. And so I'm really careful. Like when I come in, I might push the door open. I might need to sign in. I might need to push an elevator button. I might be using my card to get through. I'm really conscious of that, and I make very sure that I wash my hands like before I do anything else. Yeah. And that would be the same thing that I'd be recommending for people who are, just if you are out and you are touching things and you're doing stuff, lots of hand hygiene. Don't touch your eyes, nose, mouth, right? Like that really is how you help prevent spread. And then apartment owners, those are spaces you want to be cleaning in those areas. Again, the high touch surfaces, that's more important than like the carpet it's all important, but like it's the doorknobs and the things that people will touch that are probably of the highest concern. But at an individual level, you do a good job washing your hands.
I tell you, Doctor, a lot of this is back to basics.
It really is.
It's back to hand washing.
It really is.
This particular question makes me think about my grandmother. May she rest in peace, Eva Winkler. But she lived in a senior building, and she would put her foot up and touch that elevator button with her foot. She would never touch an elevator button with her hand. So anyway.
Yeah, and then whatever was on her foot is so now everybody should be washing their hands all the time. And I will say, if I look in our guidance here, which again I'll refer you to if you live in an apartment and you want to see some more details, but we have things in here about social distancing. Everything about thinking about deliveries or where packages may be left to,
sometimes you get clogged up in the mailroom, right?
Right, or things like, residents can continue to use shared laundry rooms, but if it's small, what signage you have, how do you limit, come back to the laundry room if it's a different time, lots of hand hygiene. And, on elevators here, it's really recommending limiting the number of people getting into the elevator at the same time, right? You think about
that's a good point.
A space where it's potentially harder to maintain social distancing. Yeah. So consider only getting on the elevator with people from your own household, right?
Yes.
Or take the stairs, or wait for the next elevator. Like that is that's a good thing to be thinking about.
Yeah, that's an excellent point. We were focused on the buttons, but actually there's also that close contact.
There's that close contact that can happen within the elevator setting, and that is an enclosed space, and if you're not able to kind of keep that social distance, that would be in the same way that we've said wait for the next bus if the bus looks crowded. Really thinking about waiting for the next elevator or taking the stairs, or only going in elevators with people from your own household. That again is an individual way to have some more protection. And if you are wearing your face coverings again and you've got those on outside of your household, that can help, but that's not as important as maintaining that social distancing as much as you're able to.
Yeah, great point. Okay, Priscilla Ninkimdi Robinson from Facebook. Is there any relationship to the number of COVID-19 deaths due to high blood pressure medication ACE inhibitor?
Okay.
So is there... We talk about underlying conditions, but what about the medications people are taking to treat their underlying conditions?
That's a great question, Priscilla. And I can tell you've been doing some reading. So let's talk about that a little bit. So for those who maybe haven't been following the blood pressure conversation as much, so absolutely hypertension, high blood pressure, is one of the factors that goes along with cardiovascular disease, which means sort of disease of your heart and your arteries and your veins that puts people at risk, for sure. Heart disease, lung disease are one of the factors, and it comes right after diabetes, in fact, when we look at our Chicago numbers in terms of being at risk. But what Priscilla is asking about specifically, I think, is this category of medications called ACE inhibitors. And this has been one of the kind of hot topics. Remember we talked about ibuprofen the other day? This has been another one that's had a lot of conversation online, and I think people understandably are kind of looking at the science and then wondering, should this be something I apply? So let's talk about this. So ACE stands for angiotensin converting enzyme. And it's a fancy word that basically has to do with how I'm trying to think about how to keep this fairly straightforward. The ACE inhibitors are medications that work on how your arteries and your veins can constrict your arteries more, and they impact the way your kidneys work, and all of that in turn has changes to your blood pressure. So as a doctor, I see a lot of patients with high blood pressure, and I choose different classes of medication to treat their high blood pressure. There are some classes of medication that help get rid of extra water that might be in your system. system that can rise it. There's some classes of medication that slow your heart rate down, which can change your blood pressure. This class of medications is another very effective class. We use it a lot.
But not everybody who has high blood pressure is necessarily taking
not
an ACE
everybody
inhibitor.
who no, not everybody who's taking it is, but a lot of people are. I prescribe it a lot, and especially people who have diabetes actually really should be on an ACE inhibitor in most cases because it has protective effects for the kidney. So there's a whole story about why people may be on ACE inhibitors, but the bottom line is they're a common medicine that's prescribed for blood pressure, and people do very well on it, and they're good medications. Simultaneously, there has been research into COVID about the kind of receptors that are in the lungs, and there are receptors that are ACE2, that are these angiotensin converting enzyme 2 receptors that have something to do with like when the virus comes into the body, the receptors that actually help it get into the cells and help it get into the lungs. So first of all, people were thinking like, oh my goodness, like I'm taking an ACE inhibitor and maybe in some way that is changing the way that the virus is kind of getting into my body. And then actually there has been some interesting research on different camps about for people who are very sick in an ICU, you know, might you want to give them more things that would affect ACE or is ACE a problem? Like there was some debate back and forth about does any of this help? But the bottom line is that the ACE2, the what's in your lung are not impacted by the clinically prescribed ACE inhibitors. So the medication you take for your blood pressure, based on what we know now, does not do anything to sort of change those receptors. And so in this setting, there's certainly been a lot of conversation about it. But again, I think people are you know, they're reading things and they're seeing theories and then they're wondering, you know, should I stop my ACE inhibitor, right? Should I limit this? And so the American College of Cardiology, the American Heart Association, the European Association of Cardiology, everybody has said, don't stop your ACE inhibitor. That like, based again on everything that we know, and there's ongoing research, if people stop their ACE inhibitor, first of all, you know, we don't know, there's no good evidence that that this does anything related to protecting from COVID. But what we do know is that it destabilizes people's blood pressure. If you change your medicines, you need to be going out to the pharmacy, you need to be getting blood work, you have the potential to really complicate your blood pressure control. And if you have diabetes, you definitely, you know, you lose your ACE inhibitor, you lose that kidney protection. So it's one of these things. And if you look at sort of the guidance as people are getting admitted to hospitals, like it's one of the, like, don't take people off their ACE inhibitor, again, based on what we know now. And so I would say, you know, I'm glad you've been following up on it, but this is an example of where I think people are, everybody's so anxious for kind of information and what to do that sometimes where there are some studies that have been done, they can get interpreted sometimes. And people obviously are wanting to do what they should do to protect themselves.
And it's so scary, right? We released the data. We said that 95% of the deaths were associated with these three underlying conditions. So if you're a person who has one of them, it's got to be very scary.
Yeah, but it's based on everything we know, it's not related to the fact that you're taking this medication. That's not what is causing the problem. It's the hypertension itself and the cardiovascular disease itself.
So please continue taking your medication as prescribed.
My mom takes one of these ACE inhibitors for her high blood pressure. I have not told her to stop taking that medication. So as always, you know, the guidance that I'm giving you is the same guidance that I'm giving my family members, and really, you know, want to reassure you about that.
Okay.
You know, while we're on that, I don't know if that question is, but I saw a question actually that this is reminding me of the other day that was asking about proning.
Which means,
So this, we had a question the other day that was similar to this one, where there's been some evidence that for people with very, very severe, what's called acute respiratory distress syndrome, very bad lung problems, like on a ventilator in the ICU, really sick, that there's this thing that we'll do called proning, which is literally like, instead of the person lying on their back on the ventilator, you actually turn them onto their front, and it's kind of
So laying on your stomach?
Laying on your stomach, but on the ventilator in the ICU to try to have some differing ventilation. It gets technical pretty quickly, but to have way of getting oxygen a little bit better into the lung. It's something that there's been some experimental work around, and certainly people who are seriously, like very seriously ill. This is not just people in the hospital. This is like in the ICU, on the ventilator, with the most serious effects of COVID. There is some evidence, and this is certainly something that ICUs are kind of trying in some patients, and there are big studies going on about it. But we had a question the other day that somebody had read about what's called proning, because if you lie on your back, it's called being in the supine position. There's a medical term for you, supine. And if you lie on your stomach, you're in the prone position. And so this proning, someone had written in being like, you know, should I be proning? Like, should I be sleeping on my stomach? And no, no, this is not, again, this is sort of an example of something that for a very subset of very sick people, there's some really important, interesting work happening. And trust me, folks in Chicago at the ICUs are well aware of this and looking at the research, and this is the kind of thing that gets planned. But that has like no connection to people who are at home and well, or even at home with coronavirus. You don't need to change. If you sleep on your stomach, it's fine. If you sleep on your back, it's fine. There's nothing with COVID, based on what we know, that would have any change to that. So they remind me of each other a little bit, because it's like these sort of scientific research that then people are wanting to apply. And I just worry that, like, you know, people will stop their really important medicines that keep their chronic disease in control, which is the most important. Or they'll think, oh, you know, I have to start sleeping on my stomach. And you think about, you know, babies who need to sleep on their backs to help prevent sudden infant death syndrome. Like, really, like, I promise when we're putting out this guidance to the public, it's based on the science of what we know, and we are aware, we are following a lot of these studies, but just because something is important for people who are very, very sick in the ICU, that does not mean that it is a general recommendation, like, truly.
Related to what you just said, we have a question that just came in from Thomas Clyde about beta blockers.
Yeah. Okay.
I think it's related to the
All right,
ACE
so
inhibitors.
beta blockers are another class of medications that we use to treat blood pressure, and they help slow the heart rate down. But they also, beta blockers and ACE inhibitors, again, just two classes of medications that also help, like, people who may be in can have something called heart failure, like more serious heart conditions. If you are on a beta blocker, keep taking your beta blocker. If you are on an ACE inhibitor, keep taking your ACE inhibitor. There is no reason, please, to stop taking any of your prescribed medications. If you stop taking your prescribed medications, you run the risk of putting your chronic diseases in worse control, which means if you did get COVID, you would have more potential for having bad outcomes. So all of your prescribed medications, no matter what they are for, I absolutely want you taking them. We want your chronic conditions in as good condition as they can be. So no matter what you take for any of your conditions, call your doctor if you've got questions about what you should be on, as always. But for COVID, based on everything we know now, you should make no changes to your outpatient medications.
Okay, we got it. Jenny Rodriguez, what about wiping one's face on one's shoulder? Sometimes you got to scratch that itch and can't wash your hands immediately. So I mean, these are very practical questions. These are very practical.
Doing this, that's better than touching your face, for sure. Yeah. So yeah, if you've got to scratch your face and you can do it with your shoulder, that's better. Wash your hands as much as you can.
Okay. And you can use your elbow on that elevator if you don't want to use my grandma's method.
Yeah, or cover your...
Yeah. Nieves Irene Hernandez Chavez from Facebook. Can COVID-19 damage other organs besides the lungs, like your kidney or your liver, etc.?
Yeah, a very good question also. So it can. Again, this has to do with how serious the disease is, right? Again, this is a virus, right? So just like all viruses, we see very different presentations. We've talked a lot about that, you know, younger people, children, by and large, tend not to have very serious outcomes, although, again, people with underlying conditions more at risk. But as people get older and have these underlying conditions, and they're needing to be hospitalized, we do sometimes see definitely problems with other organs also coming. The infection still, it comes in through your eyes, nose, mouth. It's in your respiratory system. It sort of starts as something that is in your respiratory system. But you remember how we've talked about that it's not just the fact that the virus gets in. It also has to do with your body's own immune response to that. And we've talked about how different people and different ages and different underlying conditions can have different immune responses. And so that immune response itself, as your body is working to kind of fight off the infection, sometimes can cause other problems along the way. And so we do see people, again, who are seriously sick with COVID-19 who are in the hospital in the same way that any other infection can start overwhelming your other systems. We see that. And so we see people who are very sick who, start with the lung problems, and then we start to see problems with their kidneys, or we start to see problems with, any of the really other organ systems. And that's part of what hospital medicine is about. Like, we really, when people are sick enough to be in the hospital, we're treating the first thing they come in with, but we're watching labs, we're watching EKGs, we're doing tests to really keep track of your other systems. And so if needed, and that's another reason why, having these other underlying conditions can put you at some more risk. You imagine somebody who has diabetes that's not very well controlled, blood pressure that's not very well controlled. Their kidneys at baseline may have some difficulty, and if they're getting sick and their blood flow isn't as good and all the rest of that, their kidneys may actually be one of the first things to start really failing and having trouble with. So yeah, it can affect other people. Again, most people, the great majority, at least 80%, probably more than that as we learn about more of these asymptomatic infections, do not have a serious illness, do not ever even need to be admitted to the hospital. But the truth of the data here, 95% of the people who have died have these underlying conditions. That gets combined with the fact that just when people get seriously ill, other body systems can start to have problems.
Yeah, and if we know we have one of these underlying conditions and we haven't necessarily been managing it very well. Is this the time to call our doctor or get in and see somebody?
Yeah, I think so, especially as doctors are increasingly, a lot of them are doing telemedicine and phone call consults. We've been talking about this all along that, if you have asthma, we want you to have an up-to-date albuterol inhaler at home, right? Even if your asthma is usually in pretty good control. It's a good opportunity. We've been talking about this for months to really do what you can to be taking care of yourself right now, and a lot of that means taking the medications that are prescribed. And I think your doctor is happy to kind of have that conversation with you. I think especially before you're sick, right? We want to balance that with not having people go out unless it's fully necessary. And so again, it's sort of more of a call, and it might not be a situation. It might not be the time to go switching a lot of your medications around where you're needing a lot of lab testing, but that's really an individual conversation with your doctor. And the most important thing is that you're being serious about it. Like people who have, I take care of patients normally, right? Like every week I'm seeing patients, and some of my patients take their medications every single day without fail, and a lot of all of us forget their medications sometimes, or they decide to only take them some of the time, or they, life intervenes. It's a really natural thing. And so I spend a lot of time teaching people to put your medicines next to your toothbrush, and so it becomes something that you do regularly. And this is a time to be taking your medications regularly, just as it is a time to be trying to keep your stress levels down. We've talked about that like every day, and and doing something to get your heart rate up a little bit. This is the walking a little bit outside your home. It's just a time to try to be as healthy as we can be while not being in touch with people outside of our household.
Okay. I think we have time for one last question here. Jean Brooks, and we've had a lot of kind of medical related questions today.
Today was a big science day.
Yes. This is from Facebook. I am a healthy 75-year-old, but do have controlled diabetes and very occasional asthma, usually triggered by a respiratory infection. Will I have to stay in until there is a vaccine? I'm very anxious, but so far able to control
Yeah.
my situation?
Yeah, so great question. I think certainly I'm really glad to hear that you've been staying in, and if you're 75 and you have some of those underlying conditions, it's great. It sounds like they're in good control. It sounds like probably you're taking your medications, your A1C, which is the number that we use for controlling diabetes, is probably in good shape. It sounds like your asthma is not usually a problem. I would guess you have your rescue inhaler at home, for example, your albuterol. And I think some of these questions about this really gets into what comes next.
Yes. Yes.
And I don't have a full answer for you yet on that question. I think certainly as we look ahead to being able to lift some of the broad stay-at-home orders, we're going to have to think about protecting vulnerable people sort of within some of that. And it's part of why we're watching so closely what's happening in, again, some of these other countries and other places that are a little bit ahead of us, right? Like I told you yesterday, Wuhan, which is the city where this all started, just, I believe, yesterday or the day before, took the lockdown off. And they'd been moving geographically back. And lots of interest in terms of kind of what does this look like? How do we decide where this means? And certainly everybody is so anxious for the vaccine, but we've talked about that vaccine. It's going to take time. It's going to be, it's going to be 2021 before we really have a vaccine. So it is too early for me to say to you, you are going to be, you're going to be home sort of through vaccine time. But we are going to be thinking a lot about what does it mean to continue to protect people like you. So you're doing all the right things. Trying to keep your anxiety down, keep your, keep your risk factors in good control. And I'll remind you that, even where we talk about people in those older categories being at high risk, and they are, right? Like a much higher percentage of our deaths have been in older people. The great majority of people, even older people, recover from coronavirus. And part of what helps you be less likely to be one of those statistics is all the things that you're doing. So try not to think about months and months down the line. We're obviously thinking about sort of tomorrow and this month, but we're doing a lot of work also thinking about what comes later. And once we get to a point where this does start to come down, I want you to know that, the mayor's team is thinking in all kinds of important ways about the economy and about, social aspects of this. We're obviously thinking about the health aspects and how can we do some of this. This is where, as more testing capability comes in, that's going to be a really important part of some of what this strategy looks like. So try not to think of like, I'm stuck through the vaccine. Try to think of like, what can I do now? And it sounds like you're doing all the right things. Stay in. The month of April is really, this is kind of our, you've heard me say this,
is our bear down month.
This is our bear down month. And it's going to be hard. It's going to keep getting warm. But it's the most important time for that bending the curve, not overwhelming our health system. And as we start to see some even hopefully more progress with that, we have to start seeing decreasing in numbers before we even start to have conversations about any of this. But hang in there. You're doing fine.
Yeah. You're doing what you're supposed to be doing.
Exactly.
You're staying in and you're keeping yourself well.
Yeah. Put your face out, get some sunshine, go on the deck, but keep that social distancing.
We're going to close with some good news here. I know in our national news, we know that there are more and more people who are filing for unemployment, and so that also makes this a very anxious time for many people. I just want to remind folks that our Chicago Cook Workforce Partnership has jobs that are available now listed on their site. That's cookworks.org/worknow, or you can also text WORKNOW, WORKNOW, to 474747. Work Now to 474747. There are people hiring because we have a lot of people who need to be helping us keep our pharmacies
Essential
open
workers.
and keep our groceries open. And so there are positions, including positions related to the work that we've been doing in preparation for quarantining and isolating folks. So there are jobs out there, and we want you to know that that's a resource.
Yeah, and I'll just add one that somebody sent in. There's a volunteer-run nonprofit called the Puerto Rican Agenda that's working with others that teamed up with a restaurant called Nellie's, and they've been delivering Puerto Rican lunches to more than 30 households in the Humboldt Park area 7 days a week. They've got a campaign that's called Solidarity, Not Charity. And it's really, these nice, very local examples of people thinking about who's in my neighborhood, how can I help support them. So keep sending those in. We've got a list of them. We'll do more tomorrow when we have time.
Humboldt Park.
I'll go Humboldt Park, yes. But just to end, we have a nice picture of Stay Safe Chicago that somebody chalked on the sidewalk. So please do keep sending us in those pictures. We love seeing examples when we're out and about practicing